There's some great questions in the chat too, so I'm just going to read them out, okay? Lynn is just asking, sorry to hear you're sick, Lynn, too, if any of you have been AINs or ENs prior, and if so, how did you find the transition to registered nurse?
Yeah,
go
so I was an AIN for my whole undergrad, so 3 years. As Lynn would say, I did a lot of cross-pollinating in my AIN times. So I did disability, I did hospital, I did a little bit of aged care and palliative. So coming from that experience and then coming into aged care as a registered nurse, there was that change. And I think that change was better understood within me going through the GNC Essential course. I don't think I would have really reached my full potential as a registered nurse in aged care without the GNC course. It gave me that different look. It's not disability, it's not hospital care for me. So it definitely improved the care that I'm able to give my clients in the community in that aged care sector.
Beautiful answer, Georgia. Sanjay or Nikki, did you want to say anything to that one?
Prior to nursing, I was in a non-clinical role. I was in data management, which is very different from nursing.
Wow.
Yeah. Although
there's
some transferable, some things are transferable in terms of documentation. I'm mindful of when I document, I think about the people at the back end extracting the data, for example. I want to put it in such a way that it's meaningful to them. Yeah.
Thanks, Nikki. There's another great question here to any of you. What are we still doing or not doing in our undergraduate courses that most nurses still don't want to go into aged care? Is there any reason? Yeah, go, Nikki.
Yeah, aged care nursing, it's kind of seen as an inferior aspect of nursing, and personally I did struggle with that, I'll be honest, because I'm passionate about aged care, but then I was working as a renal dialysis nurse as well, because I just felt if I wasn't working in a clinical role, it felt like I wasn't utilizing all of my skills. And to be honest, the GNC program is something that opened my mind and my eyes to how far and wide you can go as a nurse. I mean, it was during this course I heard for the first time about digital strategies in aged care, like VR in aged care, for example. And I have been speaking to people about this, like, you need to, I've been encouraging, other nurses to get on the course as well, because sometimes we feel there isn't enough support for aged care nurses. There isn't lots of opportunities out there for aged care nurses to improve on their skills. So I think definitely, programs like the GNC programs or targeted programs to enhance the skills of aged care nurses. So we're more confident and we feel more self-sufficient in our roles.
Thanks, Nikki. That's a great answer.
I think in aged care, it's about the feeling. So when I graduated as an RN, so I thought like, if I go to aged care, then I will not learn more clinical things, as Nikki said. And because I did like 2 years of undergraduate nurse in hospital, and I learned so much from there. And I thought like, okay, if I go to hospital and I learn other things, or the more clinical things, then I'll be good if I go to aged care after that. So even myself, I did like 1.5 years in hospital before jumping to aged care. So I think it's about the person feeling that they think maybe aged care is not enough for them to get that experience. But definitely GNC is there now, and other educations are available for those nurses who wants to transit to the gerontology.
All right, Sanjay, and following up from that then, what would be your advice to undergraduate students?
So for them, if they want to get some acute clinical knowledge, I'll always recommend them to join hospital while they are undergrad. Like for me, I was doing nursing with ACU, and then I joined RPA in my second year. So that gave me lots of clinical knowledge, and that position was AI and as well as undergrad nursing, which I got like some study in that point too. So my recommendation will be still they can get some experience, maybe a new grad program from hospital, and then jump into aged care if they are really into the aged care.
Mm-hmm. Cool, thank you. Georgia, what would be your advice to undergraduate students?
Obviously, to follow their aspirations, whatever path they want to go down. If it's not aged care, then it's not meant to be. We can't force that. But if aged care has ever been a thought and you've been turned away from negative comments and stigma, like someone said in the comments, then just take a chance on it, because aged care is something that's truly special. You might not learn as many clinical skills depending on what area of aged care you go into. But if it's something you're passionate about and you're wanting to help our older population in a different type of setting, then I would go for it, regardless of the stigma. It's about making sure you're happy with your job at the end of the day and what you're doing and the differences you're making. So don't let the stigma and the negative comments hold you back, and just go for it.
Great advice, Georgia. What about you, Nikki? What would be your advice, your pearl of wisdom?
To follow their passion, and whatever path they decide to go through, to look for ways to improve on their skills and knowledge, because whatever we were taught in uni, it's just like scratching the surface. You can't live on your nursing based on what you've learned from uni. It's just a pathway just to get your foot through the door. You need to be proactive about improving your skills and knowledge.
Thanks, Nikki. Lisa, are you there just to give one?
Yeah.
Yeah.
I think my advice for me is, like, if it's really your passion, go for it. You can't just go jump into something just because you wanna have a job, because most people do that. I have met so many people that that's the reason why they jump into aged care, just because they just want to have a job. So you have to be really passionate about that. You have to love it, and then you want to do it, because it's not going to be enjoyable, and then you just come to work dragging yourself and then just wanting the day to finish. So you really have to know what you really want, and if it's not, then it's not for you. So you have to go search for something else that you're really passionate about. So yeah.